Hi, I'm Dr. Jim Hugh from Weill Cornell Medicine Department of Urology. When Timothy came to see me, there was nothing terribly surprising about him aside from the fact that he was relatively young to be diagnosed with prostate cancer.
My name is Timothy Bellavia, and I'm a prostate cancer survivor. Growing up, a lot of people in my family were diagnosed with cancer or succumbed to it. Because I had so many members in my family diagnosed or died of cancer, it was something that I would have to face. My father was diagnosed with prostate cancer. However, I think he really had it years before. Had he had a PSA earlier or maybe even an MRI, they would have caught it in time and he would have maybe he's still living today.
In the United States, the average age of diagnosis is 66 years old. So when Timothy came to see me, he was diagnosed with low-risk prostate cancer. His PSA was 5.6, and for a man in his 40s, that's significantly higher than normal. Out of the 12 samples or cores that were taken, 4 of them had Gleason 6 prostate cancer.
Because of my father's late diagnosis, he really suffered at the end. One of the last conversations I had with my father was, I really want you to get your screening, get your PSA. I'm worried that all of my sons will have this horrible disease. And so I did go to the doctor. My doctor said, you might be a little early, but okay, you're too young for this. But I said, no, I really need to know.
Prostate cancer, fortunately, is one in which there's a test, the prostate-specific antigen or PSA test, that you can draw as a blood test, and therefore when elevated, prostate cancer can be found relatively early so that there aren't any symptoms because it has not spread outside of the prostate.
I had my PSA screening, and to my surprise and horror, my PSA was very high for my age. I had just come back from my father's memorial. I flew into New York, I landed, I went to my urologist at the time, and he said I had cancer. My reaction, take it out. Get rid of it. I knew immediately that I wanted to have my prostate removed. I was brought to Weill Cornell Medicine and introduced to Dr. Who. What I liked most about Dr. Who was that he didn't sugarcoat anything. He gave me options. He told me everything that I already knew. And he says, you are correct in making that decision. That is the best decision with your family's history.
The survival rate for prostate cancer in the United States are 99% at 5 years and 95% at 10 years. And so Timothy, by virtue of being diagnosed with localized prostate cancer, that is, it hadn't spread outside of the prostate, his likelihood of survival is excellent.
Dr. Who guided me and scheduled me immediately to have the robotic surgery. His staff was wonderful. From the administration to the nurse, they all remembered my name. I felt like a rock star. He connected me with this man who just had the robotic surgery. And he was a mentor, and he texted me often and kind of just gave me the knowledge that I couldn't really get in a handbook. What are the expectation, what's going to work. Besides my husband, he was my rock during this process. And I'm so grateful. I felt really supported, and I knew I was going to be okay. Right after surgery, I continued to do my physical therapy exercises, plus I was able to travel around the country and lecture, like I did before. Today I feel 100%. I am exercising at the gym, working with my trainer. My daily routine is back to normal. My experience at Weill Cornell Medicine was incredible. Before the surgery and after the surgery, they put my fears at ease.
Here at Weill Cornell, we recommend early PSA screening so that prostate cancers are detected early and men have all the options available to them.
Prostate cancer is not about your lifestyle. It's in your genes. Get screened.
So what everyone can learn from Timothy is to get early PSA testing so that cancers may be detected before they've spread.
I knew in the hands of Dr. Who, Nurse Green, and his wonderful, friendly staff that I was going to be okay.